Hey, this is Jason. I'm going to do a foley insertion. So the first thing I'm going to do is knock on the door, introduce myself, do some hand hygiene. Hi, my name is Jason. I'm going to be your nurse today. I'm going to check the patient's armband. Can you tell me your first and last name? Can you tell me your date of birth? The patient is verified. I'm going to tell the patient, or I'm going to ask the patient if he's had this procedure done before. Sir, I'm going to do a foley catheter on you. Have you ever had a foley catheter done before? Yes or no. I'm going to explain the procedure. This is going to be a tube that enters your urethra into your bladder, and it's going to help you urinate. I'm going to ask for any allergies. Are you allergic to any betadine or iodine or anything like that? Shellfish? No. And I'm going to gather I already have my stuff, which is my foley kit. I'm going to have the patient relax, sit in a position of comfort, or lay down in a position of comfort. I'm going to ask the patient if they can spread their legs just a little bit, give me a little bit of room. I'm going to open my sterile field. So I'm going to open my package, place my package between their leg or anywhere above waist level where I'm not doing very minimal reaching over. I'm going to try to keep my area clean as possible. So I'm going to open up using the outer layers, open up the sterile kit, just like that. I'm going to take the sterile gloves out, put them off to the side, and go ahead and put them on. Put them over here so we can kind of see. So when I'm putting on the sterile gloves, just like last time, I'm going to hold the outer cuff only. Slide my hands in while only holding the outer cuff. And then open the inside of this paper. Now I can hold the inner cuff and then slide my hands in. Now, after both hands are steriled, I can make my adjustments as needed. I'm doing a male Foley. I typically like to open up as much field as possible so it stays sterile without getting anything else dirty. I'm only holding the outer edges, but regardless, I'm already sterile, so I can set that up. With a male, I will, like I said, I'm trying to maximize my sterile field, so I'm gonna just place it around the male. All right, I have betadine swabs, so I already verified he's not allergic to shellfish and he's not allergic to iodine or betadine. So I'm going to open the package. It comes with 3 different swabs. So I'm going to have a clean hand and a dirty hand. But let me go ahead and set up the rest of my stuff first. So I'm going to take my lube. I'm going to squirt it into this area right here. I'm going to set this off to the side just like so. I'm going to take my my catheter and place it into the loop. Either I can put the lube into the tray, or I can just open the package and stick my catheter and piece of my catheter in it. In this case, I don't want to get it dirty, but in this case, I'm just going to set it just like that. I'm going to place my syringe into the ports. I'm not going to blow it up. And now I have clean and dirty hands. So with my dirty hand, I'm going to retract the foreskin. I'm going to have one of the swabs. This is already open, like I said. I'm going to take one of the swabs and in a circular motion, clean from the urethra out to the outer end with the foreskin retract if they're uncircumcised. I'm going to take the swab and throw it into my dirty area off to the side. Do the same 2 more other times. So clean in a circular motion, swabbed. Last one, circular motion, swab. All right. Now, while holding a good firm grip on the shaft and keeping the foreskin retracted, I'm going to take my Foley, try not to drag it on anything, and keeping all the sterile in the clean field. I'm going to let the patient know you're going to start feeling some pressure. Try not to move and try not to kick around so we can keep everything sterile. I'm going to place the tip into the urethra and start feeding. I'm gonna keep on feeding until I reach the Y. All right. At this point, I can hold on to it with my other hand and blow up the balloon. I'm gonna disconnect the syringe and then slightly pull back on the catheter until I meet resistance. In this case, I can't pull back too far because it'll fall out. After I pull back, I'm going to go up approximately an inch and over an inch, so this way it has room for the catheter to move without getting pulled out. And then I am going to tape this to the side of the patient's leg. After this is complete, I'm going to take off all my sterile field, or first I'm going to hang my bag down low. I'm going to look to make sure that I have normal urine, and then I'm gonna go ahead and get a sample ready for to send off to the lab if need be, and that would be through this port down here. Once all that is done, I can go ahead and clean up my field and document my procedure.